Plus, I am HIV positive. My life would be far worse if I was still
Main
hooked
mode
on
of
heroin.
HIV transmission is via intravenous drug widen harm reduction services to include needle exchange programs. Also reluctant to go beyond the current drug replacement therapy. The medication helps him and other recovering drug addicts like him
Plus,
keep
I
off
am
heroin.
HIV positive. My life would be far worse if I was still hooked on
The
heroin.
main mode of HIV transmission is via intravenous drug use. Official data. Getting mosque officials on board has not been easy. Some viewed methadone as just aim is to widen harm reduction services to include needle exchange programs. Addicts come here to give up used syringes run by ones. Drugs that helps prevent such programs to go beyond the current drug replacement therapy.
We have to save platform, but at the same we want to balance the presence.
Hello, my name is Anis Nabila. I'm from Group 10. Today I will presenting topic about methadone maintenance treatment. Opioid use is a global issue affecting around 60 million people of the population aged 50 until 64 worldwide, with high prevalence of opioid users reported in Asia was 0.4% and Europe 0.5%, and the prevalence of opioid users in East and Southeast Asia was 0.2%. It was reported that cumulative number of registered substance in Malaysia between 1988 and 2006 were 300,241 detected, and in 2003 there were 20,877 drug users detected by National Anti-Drug Agency. The treatment of opioid-dependent patients became crucial to the close relationship of opioid-dependent and HIV prevalence. United Nations Programme of HIV and AIDS reported in 2014 the global HIV prevalence was 0.8%. It was estimated that there were 36.9 million people living with HIV, including cases of HIV in Malaysia increase exponentially every year, with the first case detected in 1986 and a total 100,672 HIV cases detected by December 2030. The prevalence of HIV in Malaysia in the year 2000 was 24.8% over 100,000 population, and about 3/4 of HIV transmission at the time was due to sharing affected needle for drug use. The total number of intravenous drug users in Malaysia were estimated around 100,070, and the epidemic was seen as important threat to the country. In 2003, the number of HIV among Malaysian citizens was projected to reach 300,000 by 2015. If effective intervention to curb the HIV epidemic was so, Malaysia started provide methadone maintenance treatment to the opioid-dependent patients in government facilities in 2005. The implementation of this program was as a part of the National Harm Reduction Program. The component of harm reduction include methadone maintenance treatment, needle and syringe exchange program (NSEP), and condom distribution. The program methadone maintenance treatment program was expanded and included to the other agencies such as prisons and National Anti-Drug Agency premises over the years. In National Anti-Drug Agency implemented in Cure and Care Clinic and Cure and Care Service Center. Characteristic of methadone. Methadone has been included on World Health Organization list of essential medicine. Methadone is an opiate like heroin or opium. The methadone dependent patient take a daily dose of methadone. This reduces the withdrawal symptom and craving for opiates. Methadone is addictive like other opiates. However, being in methadone treatment is not same being dependent on illegal opiates such as heroin. Methadone is more safer than taking heroin or opiate. The patient take methadone under medical supervision than it is to take heroin of under purity. Methadone is taken orally. Heroin often injected, which can lead to HIV transmission if needle and syringe are shared. Higher resources in methadone maintenance treatment. Physician. Only a medical doctor may prescribe methadone. A medical doctor should conduct the assessment on which the decision to prescribe methadone is based. Doctors also take part in the treatment planning and treatment reviews. The nurses are required to conduct methadone dispensing and supervision of its consumption. Other roles of nurses in methadone maintenance treatment include taking part in treatment reviews, providing report to clinic doctor, providing vaccination like hepatitis A, hepatitis B, and referring for infection disease testing like HIV, hepatitis, sexually transmitted infection, and tuberculosis. The first dose of methadone given to patient is low. The size of the dose is gradually increased until the maintained dose reached. The maintained dose is the amount of methadone to the patient required to prevent opiate withdrawal symptoms but does not induce euphoria. The first dose of methadone should be between 10 until 30 mg. Patients who gave recently used opiate can be given at first dose at higher end of this range. The first dose given to a patient who has not recently used opiate should be not greater than 10 until 20 mg. When determining the size of the dose, keep in mind that death from methadone overdose is in the first 2 weeks of patient have occurred at doses as low as 40 until 60 mg per day. Observe the patient 3 until 4 hours after the first dose has been taken. If the patient is showing signs of the overdose, continue to monitor the patient until 50-minute intervals. If the patient enters a coma, administer with naloxone medication as prolonged infusion. Provide the same dose daily for the 3 days. The patient will experience increasing effect from the same dose over this time. After the first 3 days, assess the patient's withdrawal symptom. If the patient is experiencing withdrawal, increase the dose by 5 until 6 mg every 3 days. Dose increase should not be greater than 20 mg per week. Lastly, in the first dose, monitor the patient for signs of withdrawal and intoxication and adjust dose accordingly to find the patient maintenance dose. This process takes several weeks. The maintenance dose will usually be between 60 until 120 mg, but may be higher or lower depending on the patient history of opiate use. Okay, next we will talk about effect of methadone. Methadone is a synthetic opiate agonist. This means it produces effect in the body in the same way as heroin, morphine, and others. It is taken orally as tablet or syrup. When an opiate-dependent person takes methadone, it relieves withdrawal symptoms and opiate craving. Onset of the effect occurs 30 minutes after swallowing, and peak effect are felt approximately 300 after swallowing. At first, the half-life of methadone is approximately 50 hours. However, with repeated dosing, the half-life extends to approximately 24 hours. It can be taken between 3 and 10 days for the amount of methadone in the patient's system to stabilize. Okay, for the last chapter, we will talk about ending treatment, which is patients who wish to stop the treatment should see their prescribing doctor to discuss their treatment option. The doctor should establish why the patient wants to stop their treatment. Reason for why they want to stop treatment may include the patient believes that methadone is not appropriate in their case. Patient believe that they no longer need the treatment, and the patient want to avoid problems associated with treatment. Also, the patient to be drug-free period to relieve from the closed setting. In adding treatment, the doctor should ensure the patient is aware of the benefit of their treatment and has made an informed decision to cease treatment. In particular, patients who wish to cease their treatment just before release should be informed the increased risk of relapse and drug overdose in the weeks following release from a closed setting. If patients choose to discontinue treatment, their treatment should be revised so that they will start receiving lower courses of methadone over a period of the time. The patient should be told this will happen. In conclusion, the methadone maintenance treatment program as medication-assisted therapy of opiate dependence that started since a decade ago was found to be successful. Most half of the patients will stay on the treatment. The treatment program was noted to be effective in reducing drug use, risking of getting HIV and other blood-borne viruses infection, crime and incarceration. The program had also protected patients from getting new infections like HIV, hepatitis B and hepatitis B, and had improved quality of life and general health. Patients were noted to feel satisfied with the treatment program.